Thank you. And could I just say thank you for giving me the opportunity to speak tonight. So I'm going to talk about perspectives from, and this is very much a personal reflection for me, but I've sort of entitled the presentation Perspectives of a BAME Midwife, namely myself. So before we start, I'll just introduce myself and tell you a little bit about what I do. So like Sue said, I've been a midwife almost 20 years now, and I am Nigerian. I was born in this country, moved back to Nigeria when I was 6, and came back to the UK when I was 20. And sort of in the middle of trying to figure out what I wanted to do, I knew that I wanted to do something that involved looking after women in pregnancy. And one day, while I was trying to figure out what to do, and in the middle of an A-level class, a friend of mine, as we were watching a video on midwives, said to me, "I think you'd be really good at that." So I thought, okay, let me look into this midwifery thing. And I fell in love with it. And I trained at the University of Hertfordshire. I spent many years working at Watford, which was my practice site, and eventually moved back to London. And I've sort of worked over a few hospitals in London. And as Sue said, because I am really passionate about midwifery, I took a job at the Whittington Birth Centre. And I've sort of been there for the past 10 years. And now I actually work across 2 birth centres. So I work at a birth centre in South London as well as Whittington. So I absolutely love the job that I do. And I would really, really continue. I would really love to continue to love this job. And just to round off my little introduction, this is a picture of my great-grandmother. So this is Mama Fakeye Faloye. And she does have an English name, which is Elizabeth, because I think at some point she was baptized in a Christian church. So this is my dad's grandmother. And we've always had this picture in our house hanging up somewhere. But I never really knew what she did for a living. And when I was halfway through my first year of training as a midwife, my dad sent me a copy of this picture, along with a little write-up about my great-grandmother. And it turns out that she was a TBA. So for those of you who are not familiar with that term, a TBA is a traditional birth attendant, which means that actually she was a midwife too. And it was a really beautiful letter about what she did for women and how she would get paid with like a goat or a few shillings here and there, and how she really looked after the community. So I do believe, to be honest, that midwifery actually flows through my very veins. And so on to COVID-19 and how it's affected midwifery services. So I would say that at the moment, we are still experiencing this. The way in which it has affected us is we've had to suspend some of the services. So that's not to say that women cannot be seen, because I think that's the general panic, is that, can I go into the hospital? Is it safe? What's going to happen if I go into the hospital? But because of that, we have had to reassess some of the things that we're doing. And so, for example, things like antenatal classes, a lot of hospitals have had to sort of stop that altogether. And the other way in which we have restricted our services is restricted visiting. So for example, when women come in labor, they are usually allowed to have a couple of people with them. Working on a birth center, we're a little bit more relaxed about things like that. So we are not really into numbers. It's really down to who the woman would like to be with her on the day. But we've also had to restrict visiting just to minimize the risk of infection and the footfall coming through the hospital. So to that extent, the women that we look after are only allowed to have one person with them in labor. So some people will have their partners, and some people will have somebody who isn't a partner, but they feel might support them better. Okay. And I would say from that point of view, just watching relationships is quite interesting to see when it's just the couple in labor. Sometimes it works really well, and sometimes you can see, especially from the partner's point of view, that it actually works a lot better when there is that second person there that can also support the partners. So it's made me sort of think about, you know, whether or not that is a good thing from the point of view of the couple's mental health. So I would say with COVID-19 and midwifery, there's been sort of an overall, what I would say, an overall sense of heightened anxiety. So wanting to know whether this is going to end, and coming out of this from the other side, what is going to happen? Are some of these restrictions that we've put in place, are we going to have to continue with them for the foreseeable future? But I would say, apart from the women and their families, the staff are also a little bit anxious about you know, are they going to catch this infection? I've certainly had some colleagues who have had COVID-19. So I would say there's an overall sense of anxiety. So COVID-19 and how it's affected me. So I think the first thing is I have a sense of gratitude. And when I say a sense of gratitude, I mean that I feel grateful that I do have a job, because obviously for a lot of people, this virus has really affected their livelihood. For people who've had businesses, they've had to close down their businesses. So I do feel grateful that I have a job that ensures that I'm always employed. And the other thing that it's made me do is it's made me quite reflective. So I've thought about my job. I do love midwifery. I have started to think about other things that I want to do within midwifery. And I've been quite surprised that I've been able to be reflective, because I think I have 3 small children and my husband is working from home. And after sort of looking after the children, you know, I often go in and do a night shift on top of that. So I was quite surprised that I actually had time to reflect, because there doesn't seem to be enough hours in the day. And I'm sure a lot of people would agree with me that that is the case, that there doesn't seem to be enough hours in the day. But it's really made me think about, am I still happy in this job? Yes, I am for the most part. What else would I like to do? And then while I was reflecting, this happened. So I'm sure everybody is familiar with this phrase. And unfortunately, in the middle of COVID-19, there was a really tragic incident that happened in the States with a man called George Floyd, who was arrested by the police and subsequently died during that arrest. And one of the things that he said was he couldn't breathe. So when I think about George Floyd, my first initial feelings were of anger. And it was very much a sort of a silent anger, if I could explain it as such. Because for me, I was very much, it was a case of, here we go again. And it was also a case of the fact that, of course, it was a horrific way to die, and it was broadcast all over the world. But actually, these things have been happening for a long time, and they've been happening in this country as well as the States. And it was just really tragic. But I think the first thing that I got really angry about was I felt there was a lot of hypocrisy from the press. So, for example, just a few weeks before this, or maybe it was a couple of months, I'm not sure, there was a conversation on a very popular morning show with a woman called Shola Shogbamiminu. And she is a lawyer, and she talks a lot about race relations. And they were discussing the treatment of Meghan and Harry in the press. And of course, a lot of people have said that this is sort of racially motivated, that perhaps she wouldn't have been attacked as much if she was white. And there's been a lot of comparisons to the way Kate was treated to Meghan, and like identical stories where Kate was made to look very positive and Meghan was made to look very negative. And I remember she was being grilled by the presenter, and she was being asked to explain and justify why she thought that Meghan's treatment was racially motivated. And she very calmly answered that actually it's not for her to explain. It just should be accepted that this is what it is. So fast forward a couple of months, when the George Floyd thing happened, she was back on the same couch with the same presenters. And of course, there was nothing to debate. But it made me think that, is this what it takes for people to accept that there are these tensions? It actually takes for somebody to be on the floor for 8 minutes and 46 seconds with somebody's knee on their neck and to die, and for that to be broadcast around the world before we can accept that this is an actual problem. So I was quite angry about the hypocrisy in the press. So going on to that, I started to look at how people were reacting. And a lot of the stuff that was coming out was the shock. And again, I was thinking, okay, there is the shock, but we know that there are these tensions. So I found it really, I'm not sure what the emotion is I'm looking for, but I found it really, in a way, unacceptable that this is what shocked everybody. And it was almost as if everything up until then wasn't shocking. It was just something that we had to live with. So I had a lot of mixed emotions to do with that. And I just want to read out a few names before I go on to the next slide. So there's a man called Andrew Okorodu. who was also somebody who was sort of arrested by the police. And it turned out that he wasn't the man that they were looking for. And in fact, they were looking for somebody who was white, who had a completely different description and was wearing completely different clothes, and actually was standing there while they arrested him. And he actually went off with the bicycle that was stolen that they were searching for. And this happened in the UK. And I will get back to that in a minute because of something that will become clear to you in a minute. So what does this mean for midwifery, all of this stuff with race relations? So I think the first thing that we could think about is the Embrace report. And as Sue was saying at the beginning, that the Embrace report is a report that looks into maternal deaths and why women die in pregnancy and childbirth. And one of the things that came out that I think is, really tragic news is that if you are a Black woman, you are 5 times more likely to die than a white woman. So the figures really are, for every 100,000 women, 38 Black women will die. If you have got mixed ethnicity, you are 3 times more likely to die. So the number goes down to 23. And if you are from an Asian background, the number goes down to 13. So Asian women are twice more likely to die. If you're of mixed ethnicity, it's 3 times more likely. And if you're a Black woman, it's 5 times more likely. So when I think about these figures, I think about how people have reacted to what's happened. And social media was a real eye-opener for me, because actually on social media, people sort of sit at their keyboard and they type their thoughts. And I think that what people type are what is in their minds. And for me, it was really depressing to see the responses to some of the things that were happening. So I've had people say things like when the Black Lives Matter movement were doing their protests, people were saying, why are these people out? Don't they know that the COVID-19 is going to spike? I had people that were sort of saying on social media, well, I'm done with this Black Lives Matter, all lives matter. And there were also people who were sort of really, to me, were just deliberately choosing not to see what was in front of them. And I think when I look at it, I think it's not just it was people. Some of these people were midwives, healthcare professionals. So when I relate it to the Embrace report, I think if those are your views, and if we as the BAME community have to sit down and try and argue our way through having equal care and argue our way through why the Black Lives Matter is so important, then when you look at women coming through our doors and you potentially have staff who have these views, then how can those staff really genuinely treat people with equality? And it's a really harsh truth. And it's not about, I'm not targeting certain people. I'm just trying to get everybody to see what I'm trying to say here, that there are people who have those views, and it could just be that's the way they've been brought up. They generally don't see a problem. But we have to be honest about this. And we have to say that if we have people who have these views within the healthcare profession, then there is no way in which they can treat everybody with equality. And I think that's a very harsh truth, but I think that one of the ways of moving forward is that we need to confront this, and we need to acknowledge that this is a real problem. So I just wanted to very quickly give you a personal experience about something that happened when I was a midwife a while ago. And it's just really because I've been reflecting about things a lot. I'm hoping that by telling this story, it might make people reflect about maybe things that they might say, or maybe things that they've heard in the past as well. So I was doing a night shift on the postnatal ward, and I was working with 3 other midwives. They were all Black midwives, and there were 2 maternity support workers on the ward that night. The maternity support workers were white, and at some point during the night, a woman came up to the nursery where the maternity support workers were checking the equipment, and she asked for some breastfeeding support. So one of the staff, one of the MSWs had said, we will come and help you, go back to your bed and we'll come and help you. Now, as the woman walked off, I'm not sure if they said anything about the woman, but they certainly said something and they laughed. So the woman was quite upset about this. She complained to her husband, and in the morning, the husband made a complaint. So because the woman was quite sure where she had gone to get the help, when one of the MSWs was questioned, she denied that it was her who had laughed. But what she then said was it was the African midwives who were in the office who were chatting in their language that had laughed. So when I heard this story, it made me laugh a little bit because I thought, well, I'm Nigerian. So in Nigeria, we have 250 odd languages. I speak one of 3 major languages in Nigeria, and I speak English. My aunt speaks a dialect of Yoruba. So when she speaks to me, I understand her 60% of the time. 40% is just nodding really and like agreeing with what she says. So for me, I thought it was quite an ignorant statement to say the African midwives in the office were making these comments, because I remember this, and this was quite a few years ago, but these things stick with us as they do with the women that we treat. And that's why I always think it's really important that we have to be very careful about the way we talk to each other and the way we talk to the women that are in our care. And I remember when I was a student, somebody saying to me, women will always remember what you say to them when you're looking after them. So you need to treat them with respect and dignity. And when I look back on the midwives, I remember the midwives I was working with at the time. And I remember one of them was from Zambia, one of them was from Kenya, and one of them was from Zimbabwe, and I was Nigerian. So it made me laugh because I thought, what language did this maternity support worker think we were talking together? But it was also sad because I felt that there was a definite lack of understanding and a lack of wanting to understand and wanting to treat everybody with dignity and respect. So on to the next slide. Okay. So when I think about how this will affect my future practice, I think I will definitely be more outspoken. So one of the ways in which I'm being more outspoken is actually doing this. I feel that I want to do something to change things. The cynic in me thinks I have lived with this. I remember in 91 when I was 15, and we had the Rodney King incident, which was also an American man who was beaten by the police, and it was filmed, and he was a black man and he was beaten by these police, and it was blasted all over the TVs and everywhere that we were. But I feel that even though I think that maybe things will not change or will take ages to change, I cannot sit down and do nothing about it. So I'll be more outspoken about things. And by being more outspoken, I just mean that hopefully by doing this talk, if I've reached one person today who might think a little bit more about these figures, that will be good. And the reason I say this is that I actually remember somebody saying to me on social media that they were really upset about the figures from the Embrace report. And when they tried to talk to a midwife about it, this midwife actually said, this is just not even true. So I think I will continue to speak. I will continue to have dialogues. I absolutely, like I said, I'm very passionate about education. I know a few students who have reached out to me on social media, and I will be, hopefully, fingers crossed, on the 15th of December, I will be doing a talk with some students at Staffordshire University based on, how we treat BAME women and based on experiences that I've had, just so that they can understand a little bit more and perhaps it will affect their future practice. So that's what I'm going to do. What will you do? So when we think about when I say what will you do, I mean, they are all very small, simple steps that everybody can take. The first one is do not stay silent. I know that it's a very difficult and uncomfortable conversation to have, but I'm sure that we've all been in situations where somebody has been treated unjustly, and maybe they've been treated unjustly or not treated well because of the color of their skin. So have those conversations, and it's not about having a shouting match in the middle of the ward, but you can take whoever is doing this aside and say, look, I don't think that was right. I think also when we look at our senior staff as well, and I think Mala also brought that up in her discussion, look at your representation in senior posts. It's not enough to just say, oh, they don't come forward for the interviews. We need to dig deeper. Why are the BAME community not coming forward for these interviews or for these posts? Why are they not applying in the first place? It's not enough to say, well, we invited them, but they didn't come. I've been involved in quite a few community projects, and this is nothing to do with midwifery. It's just things like the school and church and other things where I live. And whenever I bring it up that we are not reaching the full community, sometimes the attitude I get is, well, we've put it out on Facebook or we've emailed everybody and they haven't turned up. And I try to say to them, some cultures are really different. You actually have to go right up to them and say, we would like you to be involved in this project. So I personally feel it's not enough to say, well, nobody came forward. We need to be actually looking into why people are not coming forward. But also, if we think that we are representing the BAME community in midwifery, we need to have BAME midwives also who are going to be there, maybe to advise and to help and to give suggestions as how we can make this care better. And involve BAME staff in decision making. So again, I think it's really lovely sometimes that we want to do things for the BAME women in our community, in our care. But I think it would be really good to involve staff and say, do you think this is a good idea? Because somebody actually said to me that it's a good thing that we have recognized that BAME women are more likely to die. But also, when we think about it, if we then put BAME women in one box and say, you get all this care, we need to also ask those women, because they might start to feel a little bit marginalized and, are they a problem? So we absolutely need to be including our BAME staff and our BAME women in their care rather than making the decisions ourselves. And the last thing I would like to say is also to educate yourself. And when I say educate yourself, I mean very, very politely. I love to talk. That is my passion. That is what I'm putting into what I'm doing right now, talking. And I don't mind having these conversations, but I think what's really important to know is that we are not the spokespeople for the BAME community. So we are not here to answer your questions 24 hours a day, 7 days a week. So if there's something that we want to talk to you about, don't get offended if we don't want to talk about it, because it could be that that's the 7th time that day that we've been asked that question. So for example, when the George Floyd incident happened, a friend of mine she rang and asked me how I was feeling. And I had done nothing but speak about this. And I know that for her, it came from a place of wanting to care for me. But I very politely said to her, I just really don't want to talk about that. And then I proceeded to talk about it for 20 minutes. But that's what I mean, is that there are resources that you can access to find out a little bit more. And I just want to end with an example of how sometimes you can target one person and say, I want to talk to you about this and I want you to give me all the information. So again, another sort of fairly popular TV presenter who had been very sort of disparaging about Meghan and Harry, but was all over the George Floyd incident, was interviewing a musician called Dizzy Rascal. And he was interviewing Dizzy Rascal about something completely different, but then decided to ask him about the Black Lives Matter movement. And Dizzy very politely said he didn't really want to talk about that. And the presenter then tried to make it about him being aggressive. And suffice to say, Dizzy Rascal put him in his place, which I'm very happy to say that happened. But again, I think it's about understanding our feelings. So including us, understanding our feelings, educating yourselves, do not be silent, and involve us in the decision making. And just very finally as well, I would just like to say again, thank you very much for the opportunity to talk, and I welcome any questions.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.